Hi, this is Saul. I'm a naturopathic doctor, and in this video, I will be discussing PMS and how to cure it. And when I use the word cure, I really mean that. PMS is not something that women should expect that they have to go around their whole lives with. Women are often taught as teenagers that PMS is normal. In reality, PMS is not normal. It is not just the way things are. It is not part of being a woman, and it is not something that a woman really should believe that she has to live with. In truth, once you understand what PMS is, once you understand why the body manifests it, it's actually pretty simple to treat naturally. So what is PMS? Well, technically it is symptoms that correspond to the luteal phase or the second half of the cycle before the period, and symptoms that are absent during the follicular phase or the first half. We're looking for symptoms that reoccur every month and symptoms that are severe enough to interfere with some aspect of lifestyle. In practical terms, there are many symptoms of PMS. This is only a partial list. So if I'm working with a woman, I don't ask her, like, do you have this symptom, that symptom, and go through all of these. That'll take 30 minutes. I simply ask, do you have any symptoms that come and go with your period? The most common symptoms is going to be a heavy period. It's going to be a painful period. Also, water retention is up there, and mood swings. But really, any symptom at all that comes with the period is going to be in the realm of PMS, and because it's cyclical, because it's in line with your period, you know it's somehow related to the hormonal system. And then we have this other diagnosis, PDD, which is really more severe PMS. And the diagnostic criteria is to have 5 of the following symptoms. And we can go through this: feeling sad, hopeless, feeling tense or anxious, lability of mood interspersed with frequent tearfulness, decreased interest in usual activities, persistent irritability, anger, increased interpersonal conflicts, difficulty concentrating, feeling fatigued, lethargic, or lacking in energy, marked changes in appetite, which may be associated with binge eating or craving certain foods, hypersomnia or insomnia, subjective feeling of being overwhelmed or out of control, breast tenderness or swelling, headaches, or a sensation of bloating or weight gain with tightness of fitting clothes, shoes, or rings, joint or muscle pain, and suicidal thoughts. So what is wrong with this PDD or premenstrual dysphoric disorder diagnosis? Well, it's in the DSM-4, and that's the Bible of psychiatry. So it's a psychiatric diagnosis, but not a medical diagnosis. It's not a real medical condition. As this is explicitly stated, by the way, in the DSM-4, that a psychiatric diagnosis is not a medical diagnosis. A psychiatric diagnosis does not explain the underlying physiology for anything. All it is a fancy label for some mental symptoms someone has. So in reality, PMS is directly related to the hormonal system and toxicity, which we're going to get into a little bit later. It's not a mental illness. There's nothing wrong with the brain. There's nothing wrong with brain neurotransmitters. There is no scientific proof or evidence for this as a causal factor. Yet people are given these diagnoses, which are literally just made up in committees, really in order to justify the use of psychiatric medications. And by the time I'm done with this presentation, I hope it's clear how wrong this approach really is. So there's 2 main treatments for PMS in conventional medicine. One is going to be birth control pills, and the other is antidepressants. So let's go through both of those and talk about what's wrong with them. When it comes to birth control pills, we can start entering into the realm where politics interferes with health, which is not something that I'm a fan of whatsoever. If a woman wants to take birth control pills so she's not fertile, that's her decision and that's fine, but we should not pretend that this is done for the sake of promoting health. The bottom line is that nature is a dictatorship, and according to nature, a healthy woman of childbearing age is going to be fertile. A substance that disrupts a woman's endocrine system to the point where she is no longer fertile really is by definition a poison. So this should be very intuitive that you cannot take a healthy woman of childbearing age, give her a substance that disrupts the hormonal system to such an extent that she's no longer fertile, and then claim that this is balancing her endocrine system. Because if it truly was balancing her endocrine system, then it would potentially be able to take someone who was infertile and help them to become fertile if the problem was hormonal. And what we really have with the mass use of birth control pills to treat all sorts of ailments that women have is you have the conventional medicine turning being a woman itself into a disease. So they will give birth control pills in philosophy really to treat the condition of being a woman. Now, regardless of what medical condition a woman has, if she's given birth control pills to supposedly treat that condition, the best that the birth control pills can do is to poison her endocrine system to such an extent that her body is no longer producing a symptom. But I don't understand exactly how this is treating an underlying problem or promoting health. This is really going far away from the realm of physiology and science, and just into, again, this philosophical disposition that being a woman is a disease and that this is something that should be treated in and of itself. And within this philosophical disposition, we're not trying to balance the female endocrine system. We're not trying to balance the hormones. We're not trying to facilitate the female body in its monthly cycle. We're just trying to shut it down. And that's why I say that taking birth control pills for something like PMS is really treating someone for the disease of being a woman. Of course, sometimes a woman may not have many side effects at all. Sometimes she may have a lot. But if a woman is taking birth control pills, she should do her research. She should go online and look up all the side effects of those birth control pills. Many times medical doctors will prescribe these birth control pills as if it's candy. These are powerful hormone-disrupting drugs with multitudes of side effects, and they are not candy. They should not be prescribed for something like PMS, which can be treated very easily naturally. Birth control pills should not be prescribed to teenage girls as a rite of passage, which sometimes seems to happen. We really should understand that these are powerful, poisonous agents. If in the overall scheme of things you feel you're better off taking this so you're not fertile, that's one decision. But let's not call it a medication to treat a health condition when it simply is not. And what's the other drug that women are given for PMS? Well, antidepressants. Antidepressants do nothing to promote health. They are nervous system toxins. We do not know what they do or how they work. So if someone tells you that you're taking a drug with is a SSRI or selective serotonin reuptake inhibitor, and that this is because you have a chemical imbalance in your head with serotonin, and this drug is going to fix that chemical imbalance, that is just medical quackery and lies on so many levels. Number one, we don't know what these medications really do. There is no study whatsoever showing these chemical imbalances with serotonin. There's no reason to believe that the medication would correct such a chemical imbalance, even if we knew the chemical imbalance was real. These medications have numerous side effects, and they're just nervous system toxins. My view of the psychiatric medications is that when someone has a feeling, whether it's anxiety or depression, instead of actually working on the cause of that, whether that's emotional, whether that's mental, whether that's physiological, someone can take an agent which numbs down the nervous system so they're not able to feel what their body really is feeling. So that's not treating anything. If you think in the overall scheme of things that you'll be better off numbing down your nervous system and numbing down your brain, again, that's fine. But let's not pretend that this is treating a chemical imbalance or that there is some physiological rationale for these medications when there simply is not. So to summarize the first half of this presentation, we have three stupid things that women are told. One is that PMS is normal. The other is that nothing can be done about it. And then finally, women are told that symptoms can be treated with birth control pills or antidepressants. To be more technical, symptoms can be suppressed with birth control pills or antidepressants, but you're not going to treat the underlying cause of PMS by taking these medications. Now, right before we get into the specifics of what causes PMS and what to do about it, we need to understand that the body produces symptoms as a response to an underlying problem. I can say this about PMS. I can say this about many, many other diseases. Often, the body produces symptoms as a detoxification response. Something bad comes in, so the body produces symptoms to move that bad thing out, or maybe it creates a cyst or something to wall up that bad thing inside of the body. It's the way that the body has of dealing with toxicity. When we fix the underlying problem, the symptom will go away, and thus the problem will be cured. So if we help a toxic body with detoxification and we help facilitate that process of moving toxins out of the body, then maybe the body doesn't have to produce detoxification symptoms such as PMS. But also understanding that, then we can say that if you suppress the symptoms, you might get a momentary appearance of improved health, but the long-term consequences that are worse than if no treatment was initiated in the first place. And that's because if you suppress detoxification, you're holding toxins in, and in the long run, that's not going to be good. So we get to the question of what is it that causes PMS. It really is going to come down to toxicity, both endogenous toxins that our body produces and then needs to detoxify itself from, but also exogenous toxins which are coming in from the outside world. Going over the basic physiology, every moment of the day, the ovaries are producing estrogen. Meanwhile, every second, the liver is detoxifying estrogen. Through this mechanism, the body can fine-tune exactly how much estrogen it has each moment. Also, the estrogen that is processed by the liver must leave the body through the digestive system, and if something goes wrong there, it can get reabsorbed. So if there is an imbalance of the liver not being able to get rid of all the estrogen that is coming into the system, you're going to end up with high estrogen and often through other mechanisms, low progesterone. And this is what's going to lead hormonally to PMS. Keep in mind the basic concepts here. The liver is responsible for removing fat-soluble toxins. If the liver is overwhelmed, it won't be able to detoxify those toxins. Some will stay in the body, and then the body will look for some other route of elimination, such as heavier bleeding during a woman's period. So here we can see that PMS symptoms are actually the body's best attempt, given the situation, to deal with a toxic assault. Let's get a little bit into what specific toxins are we talking about. We do have the estrogen made by the ovaries. That has to be eliminated. But we're also living in a very toxic world. You might hear people can say that soy is the problem, but not that I'm going to recommend that people load up on phytoestrogens from soy, but the phytoestrogens from soy are pretty natural. They're in lots of different plants, and they actually have beneficial effects in appropriate amounts. The really nasty toxins which should get attention are those in xenoestrogens, or those found in plastics. Now, if you want to get lots of estrogen-mimicking toxins, the best way to do that is to eat food that's wrapped in plastic, especially fat-soluble food like cheese, because that cheese is going to suck up the toxins in the plastic. Whereas if you have something that's not fat-soluble, like an apple or something, that really can't absorb the fat-soluble toxins. You can also get it from things like water bottles. Sometimes you might be drinking out of a water bottle and you can even taste the plastic in the water. That is not a good sign. Also, microwaving food in plastic, you don't want things to be heated in plastic, because then the toxins are going to leach out of the plastic into your food and you're going to be eating it. And also, when you get a blood test done to look at your hormones, if they test estrogen, you're testing for the natural hormones that your body makes. they're not testing for these xenoestrogens. So these are estrogen mimickers that are much more powerful than the natural estrogen your body's making. It's not found in lab tests, but it can surely produce physiological effects such as PMS, as your body needs to come up with some way to deal with this unnatural toxic assault. Something else to consider is gut dysbiosis. In order to detoxify estrogens at the final stage, the liver will take estrogen and it will attach it onto an amino acid in order to make it water soluble and thus move it out of the body. Some types of gut dysbiosis have a compound called beta-glucuronidase, and what that does is it deconjugates estrogen from the amino acid carrying it, turning it back into a fat-soluble toxin where it can be reabsorbed into the body. So gut dysbiosis, or an imbalance of the gut flora that we have in our digestive system, that can be a factor in PMS as well. So let's get into what a basic treatment plan would look like. First of all, we need a healthy diet that does not have packaged processed foods. We're not going to use the microwave because that's a good way of injecting toxins into our food besides other negative effects. We want to try to keep food stored in glass when possible. We don't want things really stored in plastic. We're going to try to reduce that whenever we can. In terms of supplements, during any protocol for PMS, I'm always going to want liver support. Not support to lower pain, not support for the ovaries. That's not the major thing. The major thing is to support detoxification. Supplements like milk thistle, dandelion, beets, that sort of stuff. It's going to help the liver do its job. There are many other liver supplements out there, but these are some of the more predominant ones. We also want to support digestive system function because we want the toxins that the liver works so hard to get rid of to actually get out of our body. Additionally, if there's a lot of gut dysbiosis going on, if there's an imbalance of the flora in our digestive system, that's going to create more toxins for the liver to detoxify. The less overall burden on the liver, the more energy and resources it's going to have to working on the estrogen. So we want to take things, if appropriate, such as probiotics or digestive enzymes. Also, if leaky gut is involved, that's a whole other story, but then something has to be done for leaky gut, also called gut hyperpermeability. Also, if there's something going on with candida, if there's yeast infections, if there's other signs of candida overgrowth, that needs to be killed off. I mean, there are some basic supplements, oregano, garlic, berberine for it. If this is a really bad case, it might be worthwhile to actually work with a professional because candida can be pretty tenacious. If there's issues with circulation during a woman's cycle, if she's holding onto water, there's some supplements that help with that, like dandelion, taurine, vitamin B6. B6 can be very, very helpful in PMS. One way to kind of tell if you may need it is dream recall. If you're having nightmares, you don't want to have vitamin B6 because it will potentiate that. But someone who does not have good dream recall or just never remembers their dreams at all, they're probably going to be a good candidate for vitamin B6, and that can help. Vitamin B6 is available in several different forms. I usually just go with the P5P form because that's activated and the body can make better use of that form. One real superstar supplement for PMS is DIM. It's also called indole 3-carbinol. The two are actually different supplements, but they're very, very similar, so I kind of just lumped them together. And this is specific support that helps the liver metabolize estrogen. And this could be something that kind of makes or break a case. If it's a very difficult case, you can get DIM in there for extra support. However, my bias is not just to treat PMS, it's to get someone healthy. So if there's blocks in detoxification, it's my preference not to just give DIM for PMS symptoms, but I want to go through all the liver supplements to work on detoxification in general. So to me, DIM should be used more as an adjunct. I don't want to just work on PMS symptoms with DIM and leave someone with a toxic body. I really want to get them healthy. For direct hormonal support, something that I like a lot is chaste tree. This helps supports the brain's communication with the ovaries. Specifically, it's going to help balance out the production of LH and FSH. This is support to kind of get the cycle re-regulated. So it's the type of thing that you can take for a couple months while doing everything else, and that's going to help facilitate that communication. So hopefully your body's going to get reset to the new hormonal levels more quickly, and you're going to see quicker relief of symptoms. But again, something like Chase Tree is support. It's not the main thing. The main thing is detoxification. You don't want to just go out and take all these supplements for regulation of hormones and for the ovaries and to reduce pain and all that, and leave yourself with a toxic body. Because at that point, you're basically doing the same thing with supplements that one would do with medications. I mean, it is better to do that with supplements, but you don't want to just mask symptoms. You want to work on the true underlying cause. And finally, perhaps the most important thing is some patience. When you're working on a detoxification plan for PMS, you want to see gradual improvement from one cycle to the next. And often you have to start looking for improvements at the second cycle after you started taking supplements, because things are kind of already in set when you first start taking your supplements for the period that's going to come in about 2 weeks. So you also, we don't want to just throw supplements at the underlying problem. What I went over in this video is very general support. I think for most women, you have some minor PMS symptoms, taking some liver support, DIM, Chase Tree, working on digestion. If there's any issue there, they should see some improvement. If things are really, really bad, then that's the time that you might want to consider looking for professional help to really get through the problem and to move from something that's more general to much more specific support, especially if you're being told that you need to take medications for who knows how long, dangerous medications, the birth control pills, the antidepressants. I mean, those are things that women are put on for year after year after year. And for something like PMS, if someone just follows a good protocol for a couple of months, they just about always will see remarkable improvement. Okay, bye.